Welcome to our latest episode of The Technocrats. Today, we delve into the latest breakthroughs at the intersection of healthcare, life sciences, and technology. The healthcare and life sciences industry plays a vital role in our society, but it is also beset with complexities and demanding requirements. Surprisingly, the WHO reveals that millions of lives are lost each year to preventable diseases, highlighting the urgent need for exceptional healthcare and life sciences services. Nevertheless, healthcare providers grapple with challenges such as staff shortages, limited resources, and intricate regulations, further burdening this already challenging work. However, there is a glimmer of hope on the horizon as generative AI emerges as a promising solution poised to revolutionize the healthcare and life sciences landscape. Today, we have with us Mr. Partha Anbil to share his insights on transformative potential of generative AI in the healthcare and life sciences industry. Mr. Anbil is an accomplished AI expert with an impressive 28-year record of accomplishments in the healthcare and life sciences industry. He has worked extensively with healthcare providers, aiding them in addressing strategic, operational, and organizations obstacles, making him an invaluable resource for our discussion. As business area leader and ex chief AI officer of the integrated accounts at IBM, Mr. Anbil stands at the forefront of technology advancements in the healthcare and life sciences. Together, we will explore the transformative potential of generative AI in the healthcare and life sciences. Partha, welcome to the Technocrats.
Our listeners are always thinking as the market of generative AI is anticipated to increase from $11 billion to $51 billion by 2028 at a CAGR of 35%. And this actually has presented significant opportunities for the healthcare and life sciences industry, enabling advancements in various areas such as diagnosis, drug discovery, personalized medicine, and medical imaging. So in your view, what are the potential opportunities that generative AI can offer to the healthcare and the life sciences industry? And what are some of the most intriguing AI use cases you have come across in the life sciences and healthcare sector?
Thanks, Deepak. This is a very interesting question, really, because generative AI has really got so many applications possible. You take any value chain of healthcare or life sciences, generative AI can be applied. In the immediate future, like short term, most of the administrative tasks or where a lot of manual processes involved, generative AI can be used in healthcare and life sciences, including, just for example, you want to schedule an appointment with the doctor, that's for healthcare. You want to capture the dialogue between the patient and the doctor or healthcare professionals. You can literally capture that and, generative AI will do the transcript automatically without having to do anything. And also you can ask general questions to generative AI, metformin, who can take that? Is there any alternative? These are all what you do Google search. It gives you so many, list of things. So you have to click through each and every one. Whereas here, it will give you a concise answer based on that. That's an immediate application. But there are very nuanced applications of generative AI possible, right from drug discovery to post-market surveillance, adverse events, even specific therapeutic or disease area. Yes, GPT 3.5, ChatGPT breaks down after these nuanced questions are asked, whereas Turbo 4, all these things are refined LLM models where this can answer some of the nuanced, either in cardiology, oncology, disease pathology, is what you are thinking today, and that can be applied in the value chain. Moreover, in future, right now, only the text and images are being processed by GPT. You will see it's not yet there that audio, video, complex drawings and images will be processed, and therefore that is even lab results. Those things will become part of cornucopia of data, where it will have a very nuanced understanding of all the disease conditions and those kinds of things.
And definitely, I think there are pros and cons of technology, which is as advanced as generative AI. From from the time we have seen from nuclear fusion to fusion, actually meant for something else, and then it actually caused a lot of destruction as well. With that thought itself, there are many positive use cases which are actually helping generative AI in the whole human race itself as well, which is like it has potential in drug discovery by generating over 500,000 novel molecules with high predictive binding affinity to target proteins, significantly expanding the chemical space for potential drug candidates. I'm actually an entrepreneur, and I am trying to see how generative AI can help my business, and I have all the good intentions. How should I get it started with generative AI in case if I want to use it for drug discovery purposes?
Okay, very broad question, Deepak. Here is what the LLMs available in the marketplace is, first of all, not trained in any specialized data set. As of today, whether GPT or comparable by Google or some other GPT, it's not trained with any specialized data sets. When I say specialized, it has been trained only through publicly available information, crawling the web, using APIs to get the data, and that's how it is. So through transfer learning, the GPT is doing this, even if it is completely unrelated area where it has not been trained, it is able to generate the output based on what you're asking. But think of it, this is where if you're an entrepreneur, you have a very specific, very nuanced, very fine-tuned discovery question. Okay, what I would do is I'll use the data set, which is proprietary data set, which is exclusive to your company or to a particular domain area where a lot of people do not have access to that. I would train the machine, in addition to what LM is doing, to specifically answer your drug discovery questions. For example, biomics data can be used for many things, and that is the future of how you use the very nuanced, specialized knowledge, which means data, which could be omics data, which could be even claims data, which could be patient data, which could be disease data. That if you train that, that's where you see the maximum benefit. If you're an entrepreneur, that's what I would do.
Great. The generative AI also, Partha, as you know, is new, and it is basically changing the way we do things, or we have been doing things. Specifically, if I had an AI product, which I have been developing from past couple of years or enhance that, with the generative AI coming into the market and giving an advantage to new entrants in terms of the efforts which they need to do to get to the same level as I am, depending on the fact that I have used some of the technologies which were not generative AI because those were not available 2 years, 1 year, 3 years ago. In your mind, does it create any disadvantage for me? Does it impact the valuation of my current AI products, or it gives the advantage to the new entrants in any way? What's your opinion on that?
So let's try to understand the difference between generative AI and regular AI. So here is the major difference. So it doesn't disadvantage you because regular AI will not generate any new content at all. It will only give you answers based on what you trained in. That only it see whatever information input you are provided to the machine, the regular AI will only use that information and provide you. No new information will be generated by regular AI. On the other hand, generative AI is a real breakthrough. It is predicated on what is known as in computer science transfer learning. The machine is trained in one domain area or one general domain area. It understands how the structure of the sentences, how the text works, images, all these things. It transfers that learning to a different domain area, even though you have not trained in a different domain area, that machine. So that's a major advantage you have to see here. Therefore, just because you did not use regular AI, you are jumping in, it doesn't disadvantage you because this is going to generate new content. For example, it can generate some synthetic data, generative AI, which you could not do before. You can come up with the identical patients with different comorbidities. All these things can be generated by generative AI. Therefore, you can do a lot more analysis out of that. So it is very important for you to know that generative AI is quite apart from the previous technologies. Okay, but whether it's a question of when, not if. If you do not have your product being integrated with generative AI capability, you will lose the market. You will not be successful. It's imperative where the industry is going. You need to really integrate any product you are doing with the generative AI capabilities in order to even remain in the business. That's the way industry is going. So you have to think in terms of how do I use generative AI in my drug discovery, in my diagnosis. So all those things will have to be integrated into your product, whatever product you are thinking.
That definitely actually helps our listeners to also differentiate between the regular AI and the generative AI. And even if they try to build algorithms to generate content or audio or images before even the generative AI was being available, now they basically can know about that and how they can actually use it to have an advantage. With that also, you have highlighted couple of risks in your answering the question about the intriguing AI use cases itself. The 78% of the business leaders believe nowadays that ethics and responsibility should be integrated into AI development and deployment nowadays. Which basically comes to my next question is that what would be your advice and takeaway for our listeners on how they should actually go about including the AI ethics and AI responsibility in their culture, in their thought process, in their plan?
Excellent question, Deepak. This is so critical in terms of development of AI. The problem here is when you talk about ethics, it has got different connotations and shades, how it is interpreted by different cultures, what is considered ethical. Even between countries, it is different. If you're talking, but I'll give you one example in the US. Certainly, there has to be an ethical consideration in this. It should not have a gender bias. Okay, that whereas in some cultures, particularly in developing country, that is well accepted norm. Okay, so when you talk about ethics, you have to define the context with which you are doing. Absolutely, you need to bring ethical consideration. You need to bring moral consideration. Like moral consideration, as I said, you can weaponize through drug discovery some kind of a chemical weapons that is immoral, and you have to bring that moral consideration in that, and also biases involved. See, most of whether you like it or not, at the universal level or at the macro level, whatever data you have, still those data is highly biased towards, say, white Caucasian population. Okay, so it will give you a very biased answer unless you consciously put in place governance, boundaries, make sure through reinforced learning, the machine is able to understand those kinds of bias can be eliminated. Otherwise, even at the macrocosm, all the data has some level of bias. So it will give a different answer for African Americans or colored people compared to it will give a different answer. So you need to take cognizance of that, and certainly that is very, very important aspect of it. And also there could be an IP violation by GPT because it doesn't really know where this is coming from, and it may answer with the lifting a fact paragraph it has read somewhere else completely. Then that also should be taken into consideration. There are privacy issues, there are cyber security issues. For all that, you need to develop an excellent way, what you said, a framework, governance framework, making sure these kinds of risks or factors do not creep in. It is an iterative process. You cannot get that right away. You have to keep on iterating. It has to be tested. You can segment and give that segment of the population, like African American, they should test if there is a bias or not. Over a period of time, that bias can be eliminated. Those ethical considerations will be refined. There will be a common understanding of what is considered ethics. Because as I said, it's a very slippery slope depending on the context, nation, culture. So we need to have a common understanding of that. This is very critical what you asked me that last question. And I don't think the LM models are yet there, in my opinion. It will be there, it will become, but right now, still there are leakages of all these IT issues, bias issues still crop up that has to be addressed.
Thank you very much, Partha. I really appreciate you taking the time, and we will definitely appreciate your insights into the topic.
As we came to the end of the episode, we explored the critical role that healthcare and life sciences play in our society and the challenges it faces. Our guest, Mr. Partha Anbil, has shared invaluable insights, drawing on his extensive experience in the healthcare and life sciences industry. The intersection of technology and life sciences presents exciting opportunities for innovation, and it is imperative to continue exploring ways to harness these advancements for the betterment of patient care. With the continued development of generative AI and other technologies, we can look forward to a future where healthcare delivery is more efficient, equitable, and effective. Thanks again for listening, and I will catch you in the next episode of the Technocrats.